do this operation, right?
Okay.
For the exact reason, patients like you, they're so happy.
Yes.
And just tell me some of the things that you're happy about, that have changed for you.
Yes.
Since you've taken out your implants.
Yes. First of all, the time to dress for me was terrible because I don't see the symmetry. When I dress, I always hours in the closet. What I put. That is very good for me. Second, the work at home with my kids always down. When I finish to take a shower to my kids, I feel all the weight that back to me. So
see, that's something that I could never predict.
Yeah, and now I feel like I don't do nothing. I finish that and I don't feel nothing. It's very great. Okay, I continue with my work every day like before. I feel so tired all the time. Oh my God, I remember that. I feel so bad. I remember I feel back to me is always here and here, all pain all time. And that's in the third time, the 13th, doctor, I look great.
You look beautiful.
Complete. I feel complete right now, doctor.
Oh my God. Thank you.
Thank you so much.
Thank you. Hi, it's Dr. William. I'm here with Ellie. And she's 1 week out from a BBL. You know, as you can see, she's got just an absolutely beautiful shape. But when she originally came in, she was a little bit square and didn't have as much of a waist that she has now. And her hips were a little bit flatter. When I first started doing BBLs years ago, I really focused on trying to get a small waist and just trying to get a big butt. And now, if you think of a BBL, it's not just about in the butt. It's not just trying to get like a bigger butt, right? It's trying to get the prettiest shape that we can do. And then I add volume. You certainly got volume, right?
Yeah.
So we add volume, and she naturally has a very pretty OG line. But when you focus the liposuction on trying to develop it, then you really accentuate it. So you connect this to this, and that's how you get this really pretty shape. And obviously her butt has a really pretty shape and nice volume, but it kind of starts to develop secondarily from working on these other two lines, and the butt almost kind of takes care of itself. Beautiful result. I know you're happy.
Yes, I'm so happy.
And you look just gorgeous. And I mean, your waist is tiny, and it just, you know, beautiful.
Hey everyone, this is Dr. Salas. I'm a board certified plastic surgeon. I'm going to be collaborating with the team at 305 Plastic Surgery. I've been in practice for about 10 years. I did my medical school up at Tufts University in Boston, and I did my surgical training at Harvard and the University of South Florida. And now I'm back in Miami, ready to bring everybody some quality plastic surgery. So if you have any questions or any comments, please feel free to click on the link below, and I hope to see you guys soon.
Este es un poquito de marcación anatómica para ubicar, porque cuando este se acueste, todo cambia de posición. So, cicatricita aquí abajo en los plieguecitos, entramos. La esperanza, si es posible, que cuando hagamos el implante, cuando empujen los dos tejidos, se parezcan bastante. Si esto se aplasta diferente que esto. Porque son diferentes, ¿no? Y el tejido en sí es más compresible que el implante. Entonces se pueden parecer bastante. Quizás necesitamos diferentes tamaño del implante, ¿ok? Pero eso no se define hasta que entremos ahí, tomamos unos probadores, ¿sabes? ¿Ok? Eso nos va a ayudar a ver cómo se va a ver en el futuro. Entonces ya escogemos un implante estéril el suyo que se va a llevar a su casa y ponemos eso, ¿ok? Y como hablamos de esto en el futuro porque esto sí se va a pronunciar más que que está más y ya cambiado, ¿ok?
So here we did a breast implant surgery for a patient that had asymmetric breasts. One side was bigger than the other. She also had a tuberous element more pronounced on one side than the other, which created a bit of a constriction. As you can see, a herniated nipple. She had that before surgery, but now it's more noticeable because the implants are pushing up, so they're showing it. She's aware of this, and I think you can see we did a nice adjustment of size, different size implants, so you can see that they look a lot more even for her. She'll be really happy with this result. In the future, as time goes on, she might want to do some touch-ups, after children and all that stuff. But this is a fantastic result for her adjusting her asymmetries and her sizes. Today we're going to be talking about 5 things you need to know for a BBL procedure. Number 1, try to keep a good diet and drink plenty of liquids before and after your surgery. It'll help you feel better and recover. Number 2, make sure you take it easy for a few weeks after surgery and make sure you give yourself plenty of calories to work with so your body can heal. Number 3, make sure you wear your garment as long as your doctor recommends. I prefer 3 months. Number 4, make sure you avoid sitting for as long as your doctor recommends. I like 4 weeks to try and maintain as much volume as we can. Number 5, make sure you return to regular activity after 6 weeks, and make sure you include exercise so you can help maintain results, especially from a liposuction standpoint. Those are 5 things you should keep in mind when thinking about a BBL procedure. Please feel free to leave a comment, and then hopefully we'll see you soon.
Good morning all, this is Dr. Brewster. Just want to let you guys know that I am officially joined the 305 family. I want you guys to know you can now book all of your cases here. Brazilian butt lifts, breast augmentation, breast lifts, mommy makeovers. Any questions, feel free to DM us. Any other concerns, let us know. Hope to see you guys soon.
Want to know about BBL? I've got the answers for you. My name is Dr. DiGeronimo. I've been experienced in plastic surgeries for over 40 years. When you have fat that you don't like in your abdomen and in your back, we can carve it down, make you shapely, take that fat and use it in places where you really want it. And that's in your butt. The BBL stands for Brazilian Butt Lift. We're gonna give you the shape that you want. But there's some safety concerns that we're very interested in knowing about you. We wanna make sure that you're not a smoker. We wanna make sure that your basal metabolic index is lower than 35 as a safety precaution. Safety's first. We love doing BBLs here. We love to make those curves and fill that buttocks the way you want it. We have great results and we would love to have you come see us.
My name is Dr. DiGeronimo. In Spanish, it's Dr. DiGeronimo. And in Italian, it's Dottore DiGeronimo. Now it's time to talk about breast procedures. There's basically 3 breast procedures. Make them bigger, lift them up, or make them smaller. The first one, make them bigger, is called a breast augmentation. It's done with implants, either saline or silicone. Of course, the most popular is silicone. Breast lift is when the breasts get a little saggy, a little droopy, and you want to lift them, put them back into position. That requires a little bit of more cuts, which means more scars. There's variations of that, where there's less scar because there's less sagging. And of course, with breast reduction, it's the same scar, but in addition to cutting away skin, you cut away breast tissue, which reduces the size of the breast. Sometimes there's a combination of breast lift with an implant because you want to have that sexy fullness at the top of your breasts. Breast reduction even with breast implant. Breast lift with implant. So we make sure that you know what you're going to get and what you can expect in the recovery period and the long post-op evaluation.
On this patient, she had a difference of one breast to the other. The left breast was bigger, had a bigger breast pocket, and the right breast was a smaller size breast. The left breast hung down more than the right one. Did a bit of a correction by adding a bigger implant to the smaller size and a smaller implant to the bigger size, and also raising the areola up a little bit higher and removing a little bit of the diameter of the larger areola. Do the closure. We're going to do a circumferential stitch. It's almost like a donut pexy, but it was really an areola repositioning. So she's just going to have 2 scars around the areola, but we're actually going to sew this together so that the areola will be a little bit bigger than this and smaller than the opening. She'll be satisfied even though there'll still be a smaller difference than she originally had, but she didn't want that extra scar on the bottom, so we decided not to do that after testing the implants with the sizers, and we're very happy.